Hi, my name is Dave Hollander. I'm a nurse, and today I want to review the book, The Healing of America, A Global Quest for Better, Cheaper, and Fairer Healthcare. It's by T.R. Reid on Penguin Books. T.R. Reid is a correspondent for the Washington Post, a commenter on NPR and PBS, and the author of several other books. What we're talking about here is healthcare and the fractured nature of the system in the United States. The book is best summed up in a story about Nikki White. And Nikki White is a 32-year-old woman who died from lupus, a very treatable disease process in the United States. She did not have health insurance, unable to get it with her pre-existing condition in the era before the Affordable Care Act. The moral dilemma here being those without health care can and do die. In all other developed countries, they've made a different moral decision to guarantee medical care to anyone who gets sick. And the author looks at our healthcare system through his journey to help with a chronic shoulder issue, and his premise being, can we find cost-effective ways to cover every American by borrowing ideas from foreign models of healthcare? The book looks at four different models of healthcare delivery. The Bismarck model, where the worker and employer share premiums with the insurer, private health insurer paying the cost of the tab for treatment. That's the U.S. model for most people under 65. The Beveridge model, where government runs the hospitals and clinics and run by mostly government employed providers. They never get a bill. Patients don't get a bill. That's the VA system in the United States. National health insurance, which is a mix of the Bismarck and the Beveridge system. Providers are private. The payer is government. Medicare uses this system. And out of pocket, where the rich pay for medical care, the poor stay sick and die. That's used by underdeveloped countries. So how does the U.S. rank when compared to other developed countries in the system that we use? Among 23 developed nations, the U.S. ranked last in providing universal access to medical care. In terms of fairness, as ranked by the World Health Organization, we're 54th out of 191 countries. 54th. An infant mortality rate that's twice as high as the top-ranked countries of Sweden and Japan, and more healthcare spending than any other country, over 17% of our GDP. So the author asks, is the system too big to fail? And he looks at a couple of models, one being the Taiwan model, where that country rebuilt their national healthcare system that uses private doctors and hospitals with a single government-run insurance plan to pay for them. It's not funded through taxation, but through premiums. The new system has a healthier population with longer, healthy life expectancy and much higher recovery rates of major diseases. Here in the U.S., the system is highly politicized. We still have to fight the myths of socialized medicine, waiting lists, bloated bureaucracy, and cruel insurance policies that don't cover everyone. We've built a healthcare system that discriminates on the basis of health coverage. And the book brings up some interesting questions. Every other developed country has a system that covers every resident. Universal coverage, it's a tool that controls costs, improves quality, and outcomes. Which brings us to this question, does a wealthy country have an ethical obligation to provide access to healthcare for everybody? I think the book creates a simple look at the complexities of healthcare across the globe. It gives the reader an idea of the basis of different countries and what they're able to use and what works and what doesn't work, I think, for the U.S. But it's a very highly polarized political environment in the U.S., especially right now as we run up to a national election, and could help people understand, I think, the complexities behind healthcare. So The Healing of America, A Global Quest for Better, Cheaper, and Fairer Healthcare. T.R. Reid is the author. It's on Penguin Books. I enjoyed it and I recommend it. Thank you.